talk about the IV station and some general skill setup things generically here before you start. Things you want to think about is the way that you walk in, you see the arm and things like that. Hopefully what they've done is left the arm in a position that's very stable, and it doesn't really matter which side it's on, but you don't want to ever encounter an arm if it is sitting up kind of like this. We don't want to try to stick anything that's not completely stable on the table. We want it where it's either going to be completely flat, we're looking at the outside of the arm, or completely fat, looking at the inside of the arm. Okay? So divide this into several key distinct parts. The first thing we're going to do is we're going to prepare the equipment that we're going to utilize on the patient. I will begin by selecting normal saline. We'll always state normal saline. I will look at the date to ensure that it's in date, and I will look at the clarity. You may wind up reutilizing old fluids. If you do, they're usually figured out a way to reattach a plug to it so that you're not leaking things all over. So just ask what the standard is if you're not clear. The date clarity is good. I will now select a 10-drop set. Okay, we're always going to say that we're going to do a 10-drop set. And there's some very specific things I want you guys to do. Okay, number one is when you take this out, don't disconnect this paper band. Leave it intact. If you want to roll clamp it off to begin with, that's okay. You really don't have to, but it is okay. Alright, and then what we're going to do is we're going to go ahead and we're going to prepare to spike the bag, and I'm going to do it in this order specifically. I'm going to pull the bag, okay? Then I'm going to pull the spike set cap off. And the reason I do that is because if I pull the spike set cap off and wipe it all over, touch anything, I have contaminated this. I technically need to identify that. Say I would start again. So the bag first, then the spike set cap, and then I'm going to go ahead and spike the bag, alright? And I'm going to turn it, and I want you guys to watch this, okay? I'm going to fill my drip chamber, and I'm going to turn it on, okay? Look at this. Fluid is coming out of it, and I've never removed the cap at the end of the IV line, okay? They are designed to do that intentionally so that you can prime a set and then have it set up without having to worry about hitting the end of that IV line. Do not remove this cap until you're ready to actually attach it into the IV catheter when it's inside the patient. Okay? So that's an important thing to note. If you're reusing sets, that may not be there. You make sure that you're cognizant of the fact that you would not move the end of the IV line across anything that can contaminate it. I could then go ahead and hang my line, okay? And at this time, I'll go ahead and pull that, extend it out, and I'm going to lay it down in my general work area to begin with, okay? Now, I don't have to worry about where I put it because I got that cap on the end of the line, okay? And you see that I didn't tie knots, I didn't make big problems for myself and everything by leaving that thing attached while I did that. And I do that a lot of times. I do that same way actually in the field as well too. It's effective use there. Okay, so I've prepared my IV line saline that's primed out. The next thing that I need to do is prepare the equipment that I'm going to use on the patient. Okay, and here we have a prefab piece of a vein guard. Okay. But still, even if you had a vein guard and that's what they offered, or if you were going to utilize a tape or just some tape, I would go ahead and pull a couple pieces off, okay, for securing, all right, so that you have immediate access to it, and then maybe try to pull that vein guard a little bit while maintaining its sterility, at least in the contact area, so that you're going to be able to get to that, all right. If it's tape, pull 3 or 4 pieces of 4-inch piece of tape off. Okay? Put it there. You must have tape readily accessible before you actually cannulate the patient. Okay? Alright, the next thing I'm going to do is I'm going to make sure that I have, okay, an alcohol prep or something to cleanse with. Okay? I have a tourniquet. I have something available if I need to de-seat the line with. I'm actually just going to open that up and lay it on a clean surface. Alright? I make sure that my sharps box, which should already be immediately accessible, is right in my immediate area where I don't have to move or leave anything hanging. I will select my catheter. We're going to state, regardless of what it is, I would select an 18-gauge catheter for an adult patient. 18 gauge catheter, normal saline, and a 10-drop set are universal for any IV that you need to do. Okay? So I've got my catheter, and I have it ready. Okay? I have my tourniquet. At any time during this scenario, you may don your PPE, but you must specifically don your PPE before vein puncture. Okay? So at this point, I'm going to go ahead and I'm going to apply my tourniquet. Ooh, a little sticky there. Okay? Apply my tourniquet. All right? Instruct the patient. You could validate allergies if you were utilizing betadine or something. I will palpate a suitable vein. Okay? When in doubt, go where there's a whole bunch of holes in a little, rope-looking thing, and you should be okay. All right? I will now cleanse the site with the appropriate aseptic technique. One inner swipe, one outer swipe. Okay? Move it out of the way. All right? I'm getting ready for my vein puncture, and I already verbalized my PPE. I actually recommend not wearing gloves for this station. Okay? Gloves and tape don't always get along. This is the game of passing the register. I will remove my IV catheter. I do not want you guys, I don't care where you've been at, where they taught you, break the seal, all this other stuff. You do not do this in registry. Okay? I will ensure that my catheter's intact, that my bevel is up. Okay? Go to the site that I prepped. I will pull distal traction. Okay? I'm going to go ahead and insert the needle at about a 15 to 30 degree angle. Bevel down. I have flash, advance a hair further, and once you have flash, and state so. This is exactly how I want you. I know you guys are experienced IV practitioners. Do this in here, and you'll be okay. Hold still with your trocar. Reach up, grab the hub with your thumb and forefinger. Advance the hub while holding this dead still and supported on the patient's arm. Okay? Occlude above where the catheter's at. Critical step right here. Watch this. Remove it, drop it, okay? And then we're going to go ahead and directly place the IV line into the end of the catheter. It is not a critical fail, okay, to let go. However, this thing's going to get slick from previous attempts, and there is a probability that you could lose your line if you let go of it. So I advocate, and I do it in the real world, most of the time I try to keep a hand on stuff. Okay? I'm going to demonstrate to you the most common failures. At this point now, you may either put one piece of tape on, okay, which I see a lot of people want to do, however they want to do it. Okay? Underneath, overhand, okay, whatever you want to do. We don't put tape directly over the insertion site. Hold on to it. Most common mistake right here. Okay, I will now adjust my flow rate, okay, and you're going to look, and it may even flow, and they're going to say, your line is not flowing. And you're like, what do you mean it's not flowing? It's flowing right there. If you hear the words, your line is not flowing, it means check your tourniquet. That is the same thing. Program your mind, so if it says your line is not flowing, it means check your tourniquet. Oh, I left the tourniquet on. Pop the tourniquet. Adjust the line, okay, to the desired flow rate. Complete taping it down, in this case with a Venagard. Okay. Something clean, sterile over the insertion site. Put you a nice little U-shaped bend on it, okay. Adjust the desired rate, okay, and you're done with the IV part of the skill station.